there are some risks that is attached to giving your baby immunization if they have joined this. So, hey, beautiful people. Anyways, welcome back to my channel, welcome back to my page, and welcome back to my space. It's your favorite girl, Regence, your newest Nigerian African mom. Anyways, specifically today, I'll be talking about the 5 important things you shouldn't do. It's a no. Like, you shouldn't try to do them in your first 2 weeks after delivery. It's not like it's only the 5 things, but I'll just be basically picking this particular topic because these are the very most important of them all. So, as a first time mom, in your first 2 weeks, even up to 1 month, if care is not taken, there's this connection between your baby and you while the baby was still in the womb. So, the cord between the placenta and the baby's navel, because that was the process you two were feeding from. So, after they have cut it off with the navel, it's going to come with a little cord that they are going to clip. So what you do when you come back, people are going to advise you on so many methods to do with them. Please, they're going to tell you to use close-up. Please don't use close-up. Don't use herbal medicine. Don't use so many things that they're going to tell you, please. Usually, we used to use spirits, but medically they came to because it's actually very harsh for the newborn. It hurts them so well. You'll begin to notice if you're in it already, you begin to notice that anytime you use a spirit to clean your baby off, to clean your baby navel, because they're going to teach you in the hospital how you're going to be taking care of your baby navel until it falls out. And that baby navel is supposed to have fallen off 3 to 4 days. The baby navel should have fallen off if you properly take care of it. If you're intentional about taking care of your baby, stick to your doctor's advice, your nurse's advice, please. It's going to help you. Because if there are repercussions, if your baby navel falls off forcefully, there are repercussions for it. So I know you wouldn't want to deal with it. So the second one I have on my list is colic pains. Your baby is going to actually have colic. There's something we call colic, but usually our parents, they call it a stomach bite, stomach pains for the children. Your baby is actually going to cry on stop. Your baby is going to cry normally. Your baby is like after the first 1 week or 2 weeks, your baby is going to start crying. Sometimes you don't even know what to do at that point. You're depressed. That's when depression comes in after birth. So, but when you know all these things, you're going to gather this information and then put them at work. So when any of these things are happening, you're never going to be worried. Or this information is just to keep you guided and then know what to do at every given point in time in this journey. So then you don't fall into depression. So do not give your baby any form of they might tell you give bitter cola, give this thing, give. So many people are going to tell you so many things. Please don't stick to any of those advice. Nothing heals colic, nothing cures it. It's a process that the baby's digestive system, the baby's intestine, they are falling back in place. They're getting to, there's so many things that are about it, but I just want to tell you, it's on. If I want to talk about it medically, I'm going to talk about it on another video. But what I'm trying to do, but though, if you want to talk about it properly, like you want to know what colic is in children, stomach pain and all that, maybe you will leave it below the screen and below the comment section. Then I'll talk about it maybe in the next video. But what I'm trying to tell you is that do not give your children any kind of pain relief or herbally or any of those things to stop colic. Nothing stops colic. Even if you might I know you cannot stand it, like you can't stand it. At a certain time, I am just being practical with you. At a certain time, you're going to go and get pain relief. I bet you cannot stand it. You will get pain relief at a certain time because your baby is going to cry endlessly and you're going to feel pity for your child. You might go to get pain relief. Maybe I think it's your choice to give your baby pain relief, but let it be medically advised. Tell your doctor, talk to your doctor about it. The doctor, a pediatrician, talk to them about it. It's going to advise you on the best medicine to buy for your child, maybe to ease the pressure or to ease the pains, but not so that at least your baby can fall asleep mostly. So the baby don't feel that pain when he's awake, because these pains can actually wake them from sleep. So you're going to go through all those things. So what you have to do is, next thing I have on my list is waist trainer. It's very, very wrong that you have to use a waist trainer after you give birth, immediately after you give birth. It can cause bleeding, whether internal or external. It can cause bleeding. It's very, very wrong. Give yourself time to heal after you might have given birth. Your body system are just disorganized. There are so many organs in you. Give yourself time to heal, and then after then you can hit the gym and then actually start working out and wear your waist trainer, do anything you want to do. Listen, you were pregnant for 9 months, because some people, they will even go ahead to tie wrapper on their stomach. it can even cause your uterus to collapse. It's very wrong. Don't do it. So the next thing I'm going to talk about is do not use herbal concussion on your baby's forehead. I'm explaining it to you now. There is something that is usually on the baby's head. It's very soft and it breathes. So we call it frontal. Maybe if there is another English name that you can understand better, I'll look for it and I'll put it on the screen. That frontal was the thing that made your baby's head to be elastic, like in case during the process of labor, during the process of pushing your baby, so it made it flexible, soft and pliable, so that if you want to push, the baby's hair can compress and then come out to be pliable, like to be elastic. That was just the reason for that frontal. So if your baby has it, is strong, is soft, it's whatsoever, it's fine. It's fine. It's not bad. It's not a problem. Just let it be. Allow that baby be. Don't stop putting oil, charcoal, herbal stuff. I heard that people, I even seen, even when I gave birth, people were like, why are you leaving your baby's head like this? He's going to have cold. There's going to tell you so many things that is attached to it. But none of those things are true. They are not true. They are never true. Just let it be. It's fine. The baby will outgrow it. As the baby keep growing bigger, as the baby keep growing, it's going to get stronger and it's going to close up. And you see, that is why your babies, after some time, like you're an adult now, touch your head is very strong. Kakaraka is very strong. But when you touch a baby's head as a newborn baby, you see the baby's head is very soft. It's as the result of that front end that is like that. That's why. So it's helped during labor. That's how. Don't immunize your baby if the baby has jaundice. So when we talk about jaundice is as the result of a mother having untreated malaria before she gave birth. That's why, so it can cause your baby an internal problem. There wouldn't be any need for, it's very dangerous to immunize your baby if your baby has jaundice. That's why some people are experienced, some people are not experienced. There's some people that they are going to just immunize your baby, and some people don't even know that your baby has jaundice. Some people don't have that experience. They don't know how to check it. But maybe on my next video, I'm going to discuss and tell you about how you check if your baby has jaundice or not. Because there are stages that they treat you malaria when you're pregnant. There are stages. They treat you for the first stage, second stage, third stage, and the fourth stage before you give birth. Do you understand? The first trimester, second trimester, and third trimester before you finally give birth. So what you have to do is very, very important that you follow those process, so you save your child from the risk of having jaundice. Because when your child has jaundice, it's going to stress you a whole lot. Sometimes it's a very dangerous sickness. It's very, very dangerous. It has killed a lot of children, because as the result of the child has jaundice and then they didn't notice that the child had jaundice. So what they're going to do is they're going to, go ahead and give the child some kind of medication that is not suitable for that child, and it's going to put that child's life at risk. So it is very, very important for you to take your necessary treatment during pregnancy, so that your child will not have any reason to suffer any kind of sickness when the child is out. It's very good for you. So the next thing I'm going to talk about is circumcision. Circumcision is just a process of taking away a particular kind of flesh on the surface of the and of the baby, and then getting to the second layer of the skin. Do you understand? Cutting out the first layer of the skin and then getting to the second layer of the skin. So as the process of doing that, it is very possible that your child breaks out and start bleeding non-stop because of jaundice. Those are the risks that are attached to a child that has jaundice. So it is not going to kill that child if you do not circumcise that child after 8 days, 1 week, or whatsoever. It's just that the child is going to grow bigger and then going to begin to feel a lot of pain. But I understand. But the fact is that no matter how little that child is absolutely going to feel pain. We have come to the end of today's video. So on my next video, I would like you to drop below the comment section if you really want us to talk about immunization. Do you want us to talk about circumcision? Do you want us to talk about jaundice? I'm going to break it down, because as a first-time mom, you might have heard